Imagine you are in your rookie season. You are at the plate in Game 7 of the World Series. Down by 3, bases loaded, and you are at the plate in a 3-2 count. You load up, swing, and the ball leaves the ballpark. You are a World Series hero and Rookie of the Year for your amazing season. Move forward a few months later, and you are notified that you are banned forever from Major League Baseball due to a positive drug test. Drugs are something that professional sports organizations take seriously, whether it be something of a performance-enhancing drug or something of a recreational drug like marijuana. The question is, do athletes really deserve a lifetime ban for a positive drug test? First, we will discuss how many athletes do use drugs and alcohol due to the amount of stress that they put themselves under with school, a job, and their respective sport. Then we will discuss the types of addictive drugs that athletes are prescribed for the injuries that they may sustain in their sport. And lastly, we will discuss how athletes are deserving of another chance to fight their addiction. Many athletes engage in behaviors that are harmful to themselves and can negatively impact the way that they perform. It's not just drug use among athletes that is something that is very common. According to the NCAA, student athletes have higher rates of binge drinking than those that do not participate in sports. A 2017 study had also found that those who engage in high-contact sports in high school, such as football, are 1.8 times more likely to participate in binge drinking and smoking than those who do not participate. Many student athletes use drugs and alcohol to help them with the amount of stress that they put themselves under. Between having a job, going to school, and being an athlete, it can be stressful, and using drugs is one of the ways that athletes cope with the amount of stress that they put themselves under. Amphetamines are a common group of drugs that athletes use to give them energy to balance these three things. According to Scholastic Prescription Stimulants 2011, these types of medications are in the same class as cocaine and meth, which increase alertness and energy. Athletes are prescribed many different types of medications to deal with the injuries that they may receive in their respective sport. There are a lot of addictive pain medications that they may be used to help deal with their injury. According to Harvard Health, 97% of those who use opiates do not have an addictive problem. However, that does leave 3% of opioid users that do. There are a couple of these pain-relieving drugs that are very addicting. One of these pain-relieving drugs is Oxycontin, and it can become very addictive. According to WebMD, some of the side effects of this drug include nausea, constipation, sweatiness, and lightheadedness. Another one of these addictive pain-relieving drugs is Vicodin. According to WebMD, these side effects also include nausea, constipation, sweating, lightheadedness, and dizziness. These drugs can become very addicting and can even lead to withdrawal with sudden stoppage. According to the American Addiction Center's 2022 article, How Long Do Opiates Stay in Your System? Opiates travel through the body very quickly. However, you can still test positive for a drug test 1 to 3 hours after taking the drug. Athletes deserve a chance to help them with their drug use, rather than just getting banned the second that they test positive for drug use. There are a few different types of treatments that can be used to help stop addiction. According to Karina Underwood's 2020 WebMD article, the 6 treatments that have been found to be successful in treating addiction are detoxification, cognitive behavioral therapy, rational emotive behavioral therapy, contingency management, and 12-step facilitation. The 3 most effective treatment options, in my opinion, are cognitive behavioral therapy, contingency management, and 12-step facilitation. According to Underwood, cognitive behavioral therapy is valuable because it can help treat other addictions such as food and alcohol addiction. It can also help you develop coping skills as well. Also, according to Underwood, contingency management can also be used to treat a wide variety of addictions. This type of therapy reinforces your positive behavior and gives you tangible awards for keeping up with your sobriety. Also in Underwood's 2020 WebMD article, 12-step facilitation programs can be used to treat both alcohol and substance abuse. One of the more popular 12-step facilitation programs is Alcoholics Anonymous, which makes use of group meetings and social support. The question is raised again: should athletes really serve a lifetime ban in their sport due to drug use? I do not believe that athletes should serve a lifetime ban due to drug use. There are a number of different factors that need to be taken into consideration before making a big move, such as banning someone for a career that they have worked so hard for. It is important to think about the amount of stress that student athletes put on themselves due to school, a job, and practicing for the sport that they participate in. It is also important to think about the different types of addictive medications such as Oxycontin and Vicodin that they may be receiving as treatments for the injuries that they sustain. I also believe that it is important that these athletes have a chance to take care of their addiction as well. In my opinion, I do not believe that athletes should have to serve a lifetime ban unless it is something that even after therapy and the different ways to fight addiction, that it keeps happening. We need to make sure that we give these athletes an opportunity to help treat their addiction.